Femoral neck fracture in older adults is considered an orthopedic emergency and is one of the main causes of loss of mobility and independence after the age of 65. This fracture occurs in the region between the head of the femur and the shaft of the bone, called the femoral neck, and in most cases, it is associated with osteoporosis and low-energy falls. What makes this injury so concerning is where it occurs. Because the fracture happens inside the hip joint capsule, it can compromise the blood supply to the femoral head. If treatment is not performed properly and quickly, there is a risk of avascular necrosis, permanent loss of the joint, and even severe clinical complications that may lead to death. Symptoms usually appear shortly after the fall. Patient experiences intense hip pain, difficulty or inability to stand and bear weight, as well as shortening and external rotation of the affected leg. In some cases, the fracture is not obvious on physical examination and can only be confirmed through imaging studies. Diagnosis is initially made with pelvic X-ray, and when there is doubt, magnetic resonance imaging or computed tomography is used. In older adults, there is no conservative treatment for this fracture. Surgery must be performed as soon as possible, ideally within 24 to 48 hours after the trauma, as this reduces the risk of infection, pulmonary embolism, and functional loss. The type of surgery depends on the patient's profile and the characteristics of the fracture. In selected cases, fixation with screws or nails with plates may be performed with the goal of preserving the original joint. In patients with lower functional demand, the most common option is partial hip replacement, in which the femoral head is replaced with an implant. Total hip replacement is indicated for more active patients, those with pre-existing osteoarthritis or more complex fractures, providing better mobility and less pain in the long term. After surgery, rehabilitation begins as early as possible, usually on the first or second day. Treatment includes early physiotherapy, anticoagulant use to prevent thrombosis, surgical wound care, prevention of skin injuries, nutritional support, and evaluation and treatment of osteoporosis. Recovery depends not only on the surgery, but also on the patient's overall condition and a well-conducted multidisciplinary approach. At UPhysio, we follow a specific protocol for hip fractures in older adults, with rehabilitation videos organized by phases, from the bed stage to independent walking. If you care for someone who has experienced this fracture or want to evaluate osteoporosis risk, you can schedule an assessment with me or my team through the link in the description, along with access to the platform. This was the explanation about femoral neck fracture in older adults here on Fractura en 5 Minutos. In the next episode, we will talk about the transtrochanteric fracture, which occurs just below the femoral neck and requires a different surgical strategy. Like the video, share it with those who care for older adults, and subscribe to the channel. Here, orthopedics is explained with empathy, technique, and clarity.